Like, do they follow? Yeah, like, but does it follow the general framework of like how it should work?
We're going to get started now. Thank you for joining today's presentation. Our topic today is the Patient Total Hospitalizations Report, and talking about the updates that we've added or that are coming to the portal on the 11th, and talking about a program loader which will be added to the PaTH report as well. Before I get into today's presentation, I just wanted to mention my name is Kevin Phillip, and I'm a project manager with the CRISP Reporting Services team, and I'm joined with a few of my CRISP colleagues on the line. A couple of housekeeping items before we jump into the presentation. All the lines have been muted to avoid distractions through the presentation. However, I encourage everyone, if and when you have a question, to utilize the chat feature located on the bottom toolbar. I'll stop and pause throughout today's presentation to answer those questions as we go, and if I can't get to all of them, one of our team members will follow up with you after the session. We're also recording the presentation, and we will make the presentation recording as well as the slide deck materials available to all those who attended today's session, so you can share with your colleagues. We'll also publish a recording of one of these webinars. We have a couple others coming up next week that will cover the same materials, as well as the slide deck and the full-length user guide to the CRS portal next to the report itself. As I mentioned, if any of your colleagues you think would benefit from one of these trainings, we have additional sessions next week, and we'll list them out at the end of the slide deck presentation today. So with that, we can jump into our agenda. First, I'm going to cover some background about the PaTH report, you know, what you can do with it and how folks might be familiar with it now, and what are some of those changes that we've made that are coming on the 11th. We'll talk about user access, then we'll jump into the actual tabs of the report themselves, talk about how you could utilize those, and then drill down on some of the filters that are available in the new release. We'll talk specifically about the program loader application that we've added to PaTH, and then we'll just leave you with a few ideas of how you could utilize the PaTH report. So some quick background on the PaTH report. This is a tool that allows you to view cross-hospital claims for patients that have touched your hospital in the last 36 months or are on your ENS panel. And that's something that's new for this version of PaTH. I mean, most users, if you're associated with a hospital, will be familiar to the previous PaTH report as the application to view, you know, cross-hospital claims. But one of the major changes is anyone with an ENS panel can also utilize PaTH to view hospital claims on their patients. So there's two versions of the PaTH report. There is a summary version, which just includes the first tab, which is the summary tab that we'll cover later. And then there is a details view, and that has two additional tabs, one called PaTH and one called Patient Details, which I'll also touch on later. The PaTH report is populated with the all-payer HSCRC case mix hospital claims. And before I kind of jump into PaTH, I just wanted to give folks a primer on this data set. So this is a regulatory data set collected by the HSCRC. It includes visits from regulated spaces, so inpatient observation stays, ED visit, and outpatient visits. We've excluded the full OP data set from PaTH just to, you know, focus in on inpatient stays, observation stays, and ED visits, but also because that data set is quite large, and we needed to, you know, speed up some optimizations within our report. What's great about this data set is it's all payer, so it's not exclusive to Medicare or Medicaid. It includes all insurers. And we typically update our reports with a 2-month delay between date of service and when you'll see those results, those visits in the report. Before I kind of jump into some of those substantial changes that we've made to the report, I just want to give folks a primer of to guide the kind of presentation that I'm giving today and think about why you might utilize this report. And I feel it boils down to kind of 4 main aspects. The first of which is understanding the population of your patients. So you can utilize PaTH to view hospital utilizations across not only your hospital or other hospitals in Maryland, and also now you can view, these case mix claims for an ENS panel. And this just helps with, identifying data and information gaps that you might not have in your internal database, but also gives you an opportunity to think about what areas of opportunity there are with the patients that are coming into your facility or that you have an active treatment relationship with, whether that be new treatment or care coordination programs. The intention is for it to be a conversation starter where you can think about how you might explore care coordination opportunities or improve existing programs or treatments that you are, using on some of the patients that have touched your facility. Using PaTH, there are a bunch of different filters that will help you kind of drill down and identify or target a specific population of interest. And in doing so, you can kind of manage some of the expectations for your leadership or your stakeholders on what opportunities are there. Once you kind of target in on that population, using the program loader tool, you'll actually be able to, track these set of patients across time. And using that, you can also see this program in our pre-post report, which I'll cover later. This is also a good way of viewing some of those case mix claims a little bit faster than you would on pre-post, just because it's not dependent on a patient enrollment date. And then lastly, like I mentioned before, in the goal of it being a conversation starter, it will enable your group to continually improve the care that you're giving to your patients or continuously improve care coordination that you are utilizing to care for your patients that come to your facility. So with that, we can jump into some of those summary of the substantial changes that have been made and that will be made on January 11th. So first of all, not only hospital users will be able to access this report, but anyone who has an ENS panel and access to pre-post can utilize PaTH to get these key insights. We added a bunch of new filters into the report, including APR-DRG, and patient expired filters. These filters persist across tabs. That means if you make a selection in the summary page, you can quickly jump over to the patient details and view those filters and without having to make the same selection again. And a new kind of addition that we've made is if you are a hospital user and you have access to multiple different hospitals, you can view all of those claims at one time. This means if you're a person who works for a system and you have a treatment relationship and permissions to view 4 different hospitals, you can view all of those claims at one time to populate the charts and also get patient lists. We kind of expanded the use of our patient detail tab. So you can view multiple patient claims at one time, expanded the MRN search, and have enhanced the Excel download capability so that you'll be able to not only kind of query the data how you wish in Excel, but also to help you aid in building a program that you could submit to view in PaTH or in the pre-post tool, which we'll cover. We expanded the look back window from 12 months to 36. This means you get a 2 whole additional years of data on the patients that have had a visit at your facility or on your ENS panel during that time frame. We've added the case mix program loader, which I'll cover later, but it essentially enables you to upload a list of patients that you want to view specifically in PaTH or in pre-post. And again, this report is now available not just to hospital users, but ambulatory users with ENS panels. So who will get access to PaTH? Automatically on January 11th, which is this coming Monday, any user who works for a hospital with access to current PaTH will gain access to the updated version, as well as folks in the non-hospital setting who have access to the pre-post reports already. Who can gain access? Hospital users can gain access by contacting their point of contact. And ambulatory and non-hospital users with an ENS panel with CRISP can gain access to this report. We just simply ask that you reach out to your CRISP outreach contact or the support@crisphealth.org inbox to start that process. So before I jump into the specific tabs within PaTH, this is just a primer on the CRISP Reporting Services portal login page. The URL is reports.crisphealth.org. You enter the portal by entering your user ID, password, and then accepting the Authy 2-factor authentication notification. And if you don't have access to the CRS portal, please reach out to that support inbox and we can direct you to the right person to gain access depending on where you work and where your permissions are. And then once you're in the CRS portal, to find the PaTH report, it's located in the all payer population section. And then clicking the PaTH link, you'll be able to jump into summary or the detail view depending on your permissions. I also like to just remind folks real quick before I continue that if you do have questions at any time, please utilize that chat feature and I can stop and answer them throughout the presentation. So this brings us to, the first view of PaTH, which is the summary page. And here you can see we've updated the display to give folks a high-level summary chart of hospital utilization metrics. So what this graph is showing you is of the patients that have visited your hospital in the time frame selected, where else they've been in the Maryland hospital system. So you can see, the number of visits, the number of patients, charges, average charges per patient, charges averaged out by visit, and then average visits per one patient at all of the facilities. And using some of the filters on the right side, you can change where you want to look, if you want to filter just on a couple different specific hospitals, or you can expand or shrink the time frame, which this will be key, especially for folks who first launched the PaTH report and are looking at a small subset of patients. It's important to make sure that you expand the time frame selector to be able to load results, because the default view is going to be 3 months, but you can go all the way back to 36 months. So that's going to be key once you launch into the report. And then utilizing those filters on the right side, you can drill down on specific populations of patients that you would like to look at. And I'll cover the filters a little bit later in detail. The first thing I kind of want to mention with the new summary view is this top bar that you'll see. And this is a new selection bar that's been added to give folks the opportunity to select hospitals that they have access to, or ENS panels that they have access to, and or programs they wish to view. And we'll cover programs a little bit more in detail later. This is also multi-select. So if you have access to multiple hospitals, you can select one or multiple. And then same thing with ENS panel permissions if you have access to multiple different panels. In order to, make this selection happen, you must click apply once you've made the filter. And it's always going to restart you at the summary view. So if you jump over to patient details and add a second hospital or change a program selection, it's going to bring you back to the summary view before you can persist to across the different tabs. And here's just the kind of some of the options available in that view, and just gives you a sense of when you click through it, what you may see depending on your permissions. If you only have access to one hospital, you're only going to see that one hospital at the top, and same thing with the ENS panel, and then same with the program. The second tab of the PaTH report is actually called PaTH, and this provides a chart of charges by number of visits, and you can filter out the visit type, but it is defaulted to show inpatient observations, both less than and greater than 24 hours, and then ED visits. And each of those blue dots on the actual chart represent a single patient. This is a great way to quickly identify some outliers, those who have a lot of visits but maybe a low amount of charges, and those who have few visits but a high amount of charges. You'll kind of isolate those on the top left or the bottom right of the chart itself, and then kind of the middle or the average of the patient population that you're looking at is going to be kind of grouped together at the lower quadrant of the graph. The chart below the graph provides, demographic and hospital utilization metrics for the patients included. And here users can, make a selection of some of those bubbles to populate specifically the chart shown at the bottom. And here's just an example of how you would do that. You kind of hover and right click over some of those bubbles, and you can capture a large quantity of them or just isolate on one, depending on what you want to do with this graph. And again, all of those filters that were shown on the summary screen are available within the PaTH tab. So the last tab within PaTH is the patient detail view. And here you'll just see a list of all of the patient claims, both at your facility and across other facilities for the time period selected and the demographic and utilization filters selected. This is automatically sorted by MRN, so patient claims across different hospitals will be grouped together, but using that sort by filter, which is only available in the patient detail view, you can change how that table is populated. So you could group all of the visits that occurred at one hospital, that occurred by a visit type, by a specific APRD or G, and then you could also order it by date of service. And the key with this tab is users will have the ability to export anything that they're viewing in the table. And when you use that export button at the very top that's titled Excel, it will generate a CSV file where you'll be able to actually get a few additional columns, such as other diagnoses that are not populated and shown just in this Tableau view, just to best utilize the real estate that we have on the view. But those additional details can be found within the export Excel option. And then I'll just cover quickly some of those columns that you can see. So you'll have a patient MRN, the admit date for the visit, and each visit will be shown in one line. The discharge date, where that visit occurred, the type, charges, and you also get flags for if this visit was a index for a readmit or a PQI, and then you also get some diagnosis and APR-DRG descriptions alongside that visit. So now I'll kind of just jump into some of the filters that we have available within PaTH. So users will be able to filter on different hospitals. So this will be where the service was actually provided from. So if I, for example, work for Johns Hopkins Hospital, I'll have the option to, filter out any other hospital that my patients also have traveled to within the time frame selected. So you can do that with the service provided from filter. You also have a time period selection. And this is where you can expand the time period that you're looking at from 3, 6, 12, 24, 36 months. And then users have a bunch of different options when it comes to utilization metrics. And here you'll actually be able to filter on, the charges that you want. If you want a certain window of charges, you can change that slider. The number of visits that the patients had to have to show up in your selection. You also have readmissions available and looking at bedded care. And I'll mention that the readmission included in this report is based off of the HSCRC RRIP policy. We also have filters available for need type. So you have 3 options: high, regular, and rising need. High utilizers are defined by 3 or more inpatient discharges or observation visits of 24 or more hours during the last 12 months. Rising needs are 2+ visits of bedded care or ED in the last 12 months. And regular need are other patients that are not included in the first 2 categories. We also have APR-DRG filters, and you can think of this as, the main reason for the visit of the patient. It is the 3M kind of methodology to group diagnosis groups together, but you can think of it as the main reason for the visit. And users can also filter on visit type. So you can just look at inpatient only if you want to, or include all of the available visit types: ED, observation, greater than, and less than 24 hours. You also have an option to filter on patient existing conditions. And these conditions are defined by the CMS Chronic Condition Warehouse. More information about this can be found within the user guide that we have for the specific report. But you can see on the very far right side all of the available conditions that we have. Our team is looking at some more options that we can add in to these conditions, but you also have the ability with that middle kind of figure here to look at combined conditions or patients with either conditions using the and/or function. And then you have the option to add up to 4 different conditions with that and or logic using conditions 1 through 4. And then you can also slide on how many of the chronic conditions you want to look at across the patient set. Just note that this slider only applies to the conditions labeled chronic. So when you look in that drop down, these are asthma through kidney disease. So those 7 are applicable to that chronic count slider. So when you move that to be 2, for example, patients must have at least 2 of those conditions labeled chronic to pull up into the report. And lastly, we have some filters based off of insurer. So you can look at primary payer or secondary payer or a combination of those. You can also break down the data into specific demographic groups. We have age group, gender, race, and ethnicity filters available. And then we also have the patient expired filter that allows users to filter out patients, those who have deceased in the hospital itself. I'll just stop there real quick and answer any questions that folks have on the, tabs of PaTH that I've shown. One question that we had is what hospitals are included in the claims data set. So the HSCRC all payer claims is just Maryland regulated hospitals. So this will include inpatient ED observation stays at those Maryland facilities. Doesn't include any neighboring states. And we had a question about, does filtering ED visits exclude ED that has resulted in IP? So this is a good question. I think if the ED visit resulted in IP, they would be shown as IP, and therefore the ED visits are only visits that were billed for emergency department procedures and did not result in a inpatient stay. I had a question about, is there ability to filter for the reason for the visit? So using the APR-DRG filter that I showed, you can actually look at, the diagnosis groups of why the patient went in. So you could look at specific types of diagnosis if you were interested in only, ones that pertain to cardiology. So using that filter, you can kind of get at why they're the reason for visit was. Awesome. We'll continue to utilize that chat feature as I continue the presentation. So I'm going to change gears a little bit just to talk about that program loader that I alluded to that's also within the PaTH report. And those folks that are familiar with the pre-post report will recognize this program loader, because this is like the same type of application that is available in that report. But we've also made it available within the CRIS portal page itself. As we know, some facilities have a individual person submitting an ENS panel and also putting in a program into the CRS reporting tool, and they can actually do so by clicking into the all payer population and then going over to that program loader. But on the next slide, you'll see that this program loader functionality is now available within PaTH, as well as it being available into pre-post. And so utilizing this, this program loader, you're able to save a list of patients that are a subset or a full list of the population that you're looking at. To in order to do this, you'll have to start by naming your program, which this is actually very important because this is how you'll identify the program later within the reports. So you want to be very specific and kind of give as much detail as possible for you able to know what the patient list that you uploaded to this program is with that name. And then based on your user type, you can select either hospital MRN or ENS panels. And then you will select the name of your hospital or ENS panel, and then you actually upload the file itself. And to get kind of the template for the file, you can hit download template. It gives you an Excel file that contains 3 different columns: MRN, source code, and program enrollment date. And on this slide, I'll cover kind of what those 3 fields mean. So I first want to just start when I say program. This is a subset of patient or a list of patients that is a subset from the source that you're looking at or the population that you're looking at. You have 2 different options depending on your user permissions for what that source is. It can either be a hospital or an ENS panel. When you go to the PaTH patient level tab, you'll actually see the source code and MRN listed together, separated by a hyphen. So this is a really great way if you're unsure of what your source code is or what the MRN of the patients that you're curious about following in PaTH or pre-post are, to look for the source code before the hyphen, and then anything after that hyphen is what we consider the MRN for the patient. So anything listed after the hyphen, including leading zeros and letters, should be included in this MRN field when you put it into the Excel file. And then I kind of gave you 2 examples. So if I'm a hospital user, my source code MRN combination might look something like hospital_A, and that would be the source code. Then you see that hyphen, and that is after that is the MRN, so the AB_1234556. If you're utilizing an ENS panel, your source code MRN might look something like the example shown on the screen, ENS_test, and that would be the source code, separated by that hyphen, and then the MRN is what comes after the hyphen, the 1234. I think MRN can be a little confusing because depending on what source you're looking at the hospital, it's most likely definitely the medical record number. But if you're utilizing ENS panel, this is just the patient identifier that you put onto that patient when you submitted the ENS panel. The source code is the code that kind of just identifies the patient population pool that you're pulling from. So either a full hospital or a specific ENS panel. And then the program enrollment date is required, but is only specific to the pre-post report. And that is because the pre-post report looks for utilization before and after that enrollment date. So it's not necessary that, it's not needed for PaTH. So you can make this the same for all of the patients if you upload a program to view in PaTH. But just know that this is specific to the pre-post report. And then I kind of just gave you at the bottom examples of what the format type of the Excel file should be and what an example of those 3 variables would be. So once you fill out that template with the 3 variables, then you can actually upload it to the program loader and be able to view it not only in pre-post, but within the PaTH report as well, with that top selection bar. And then another important information piece to keep in mind when you're utilizing the program feature is the dates that the data is available through. So at the very bottom of the report, you'll see these kind of identifiers to show when the case mix data was through, and the last date that we have ENS panels information for. There's usually a 2-month lag in the case mix data and a 1-week lag for ENS panels. So I'll stop there for a second because I know that was a very dense section, but I hope the messaging was clear on how to utilize programs within this context. And I think something that's great about this new path is when you have that patient level detail tab uploaded and loaded in PaTH, you can export, the patients that you're seeing in that view and reformat it to upload a program that you want to follow in pre-post, or also just jump to really quickly in PaTH itself using the program loader tool. All right, seeing no other questions at this time, I'll just jump into some other use cases and leave you guys with some ideas of how you might utilize PaTH. And really, I think it's a good way to identify care coordination opportunities because you'll have the ability to filter out and identify patients who may have benefited from specific services of care coordination or other treatment types. You can also utilize PaTH to evaluate patient and care programs. So utilizing the program loader tool, you can upload that specific program or just filter to the, the program specifics or the patient types that you're looking at and kind of answer some of those questions there and set expectations for your leadership team and also identify, opportunities where you can improve. You have the ability to prospectively identify high utilizers that might be, something that's gaping in your internal data because maybe these patients have also visited your hospital, but other hospitals in the state that you might not see through your EHR. And then lastly, this gives you access to hospital claims. So for those of you who are not associated with a hospital that have an ENS panel, you can utilize PaTH to view the all payer case mix claims for these patients that you have a treatment relationship with. And this might be helpful to expand on some of the treatment that you are giving to these patients. And you can utilize those filters to kind of understand the population demographics or utilization patterns of the patients that you're actually treating. And what's really cool about these new reports that we're giving is hospitals at a system level can view multiple hospitals at one time. And then if you're familiar with the pre-post or panels for practices report, this kind of gives you more detailed information a lot faster. So this bottom actual table just gives you an example of you'll actually be able to see some of the utilization faster than you would utilizing the regular pre-post report, just because that is based off of a program enrollment date, while PaTH is the last 36 months of data for patients that have touched your hospital or that are on your ENS panel. So those are just some ways that I'll leave folks with to think about how to utilize this report. You can also reach out to us and let us know, some additional ways that you think about utilizing it, because I don't think I've covered the full breadth of what you could do with this powerful tool. But this gives you some, ideas to think about how you might implement this in your practice. So this is just a reminder that all of those updates and changes that I covered throughout today's presentation is actually going to go live on the 11th, so Monday, into the CRS portal. We're welcome to answer any other questions or feedback if you want to reach out to the support@crisphealth.org inbox, and there we'll be happy to answer any of your questions or comments. The training, presentation, recording, and slide deck will be available within the report to download, as well as a full-length user guide that covers some of those specifics if you want to get into the nitty-gritty of APR DRGs and visit types within the filters. You can locate all that information within the user guide. And then lastly, I'll just point out that we have 2 additional webinars available that will cover the same content that I presented today, but please forward these to any colleagues that you think would benefit from a discussion or an overview of the new PaTH report. And I will stop now and answer any questions that folks have in the chat. If there's no other questions, then I really appreciate you joining, and I hope you see the same value of the new PaTH report and are able to use this starting Monday. All right, well, I don't see any other questions. Again, thank you guys for joining today's presentation. You're welcome to reach out to myself. My email is kevin.phillip@crisphealth.org, but we will be sending out the recording and the slide deck to everyone who's attended today, and are happy to answer any other questions offline if you reach out to either my inbox or the support inbox. And we will cover the same materials on the 12th at 1 p.m. Thank you everyone for joining. Have a great day.